Listening to your gut is not just good life advice, it's important medical advice too. Today we'll learn more about the complexities of our digestive system and how we can improve our gut health. I'm Ashley Russo and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at gut health with experts from St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Kathy Yoon. Fellowship trained in gastroenterology, Dr. Yoon is committed to treating GI disorders and colon cancer screenings. She received her medical degree and completed her residency in internal medicine at Sidney Kimmel Medical College at Thomas Jefferson University Hospital. She earned her fellowship in gastroenterology and hepatology at Mount Sinai Morningside West in New York. Dr. Yoon, thank you for being here.
Thanks for having me today.
Can you tell me a little bit more about your interest in gastroenterology and what led you to that field within medicine?
In medical school, I started with a research project on hepatitis C virus, and that's how I stumbled upon gastroenterology and hepatology. And I kind of followed my mentor's schedule, so I did more rotations in GI and hepatology, and naturally, I just went into this path. And the more I learned about it, I love the pathophysiology of a lot of various diseases. I like the aspect of medical and procedural aspects of this field. So that's why it attracted me to the specialty.
It's a very complex field. There are so many things that come into it, and it's changing all the time, what we're learning about the GI system. Is that part of what interests you as well?
Yeah, of course. I love staying up to date with new literature. I strive to practice evidence-based medicine. So I think that's a great field. So that's why I'm in this field today.
Also, so many people are affected by GI issues, and it can affect their day-to-day living. How does it make you feel to help them overcome their medical issues to live their life fuller?
I love seeing people having better quality of life. GI system can definitely affect your quality of life. For instance, if they have a lot of diarrhea, they're afraid to go out and have fun with other people. So it's great to see how people can overcome that, and with some help with medication or some other maneuvers, they can have a better life.
Excellent. Thank you so much, Dr. Yoon. Joining our panel next is Dr. Marcel Secondari. As a family medicine physician, Dr. Secondari is committed to promoting the health of patients of all ages. She focuses on preventative medicine and believes in a holistic approach to healthcare. She received her medical degree from the American University of Antigua and completed her residency training at St. Luke's Family Medicine Residency Program in Bethlehem. Dr. Secondari, thank you for being here.
I'm excited to be here.
So as a family medicine doctor, you see patients with all types of common health concerns through every stage of life. What gives you the most satisfaction in doing what you do?
The most satisfying has to be when there's a shift in energy in my patients, when I see them beginning to trust more and getting excited about being involved in their health and improving their health and well-being. That really motivates me to keep learning and improving and providing them with the best care. So I would say that is probably the most.
You mentioned patient trust. What is your process and how important is it to really get to know your patients and understand their health concerns and their health needs?
So I think it's just about listening for sure. You want to make sure that they feel heard and allowing them to talk about their, what they do, what causes them issues, whether it's mental or physical, just letting them talk to you. And then as a provider, providing them pointers on what needs to be improved. So if we just focus on what we think is important and not address what they find important, we'll not allow that trust bonding to occur.
That is such an important point, really listening to the patient and all aspects of their life to figure out what might really be going on. Well, thank you both for being here. We're looking forward to learning more. We'll be right back after a short break, but before we do that, let's check in with Andrea Bone out in the field as she discusses the importance of diet for our gut health.
Hi, my name is Andrea Bone, and I'm a PA with the gastroenterology department, and I'm also a dietitian. So our diet is very closely related with our gut health and our entire body's health. Some of the best food choices that we can make for our own gut health is making sure that we're getting a wide variety of food in our diet. The more variety that we have with our fruits and our vegetables, different sources of fiber like nuts, seeds, legumes, whole grains, all of that helps to feed a very variable gut microbiome. Some short-term benefits of a gut-friendly diet would be maintaining normal bowel function and minimizing any symptoms that I might see patients for here in the office, which would include things like belly pain, bloating, nausea, constipation, or diarrhea. And some long-term benefits of following a gut-friendly diet would be minimizing our risk for lots of different chronic conditions. Those can include things like Crohn's disease, obesity, metabolic-associated fatty liver disease, and even different kinds of cancer like colon cancer, breast cancer, and prostate cancer. Unfortunately, here in America, we do have a generally Western diet, and that refers to a diet that's very high in processed foods. And when we talk about processed foods, that includes really all foods that come in a package. So frozen meals, packaged snacks like chips and cookies, high fructose corn syrup, sodas, fast food, things like that. And the problem with those foods is that they're heavily processed. They have a lot of manufacturing that goes into producing them. And all of that production really doesn't feed our gut microbiome. It also has lots of other negative health effects, like being very high in calories, contributing to weight gain and metabolic syndrome. People often ask about frozen vegetables and whether they are any less nutrient dense than fresh produce. But frozen vegetables that have had no ingredients added to them are actually just as healthy, if not more so than the fresh produce, because they're actually harvested and then flash frozen right away. So they retain all of their vitamins and minerals as when they were freshly picked. So frozen vegetables are a great way to be a bit more economically smart, but to still get all of those benefits of fresh produce. So the diet that I would like to recommend for good gut health and sustained health in general would actually be the Mediterranean diet. It's a diet that's very high in antioxidants and heart-healthy fats. It tends to have lots of fruits, vegetables, heart-healthy fats like avocado or olive oil, lean proteins like poultry and fish, and lots of nuts and legumes. That diet has actually been found to be anti-inflammatory and decrease the risk of some of those diseases that we talked about earlier. A lot of times people ask me if they need to cut gluten out of their diet, and my general piece of advice is if you don't suffer from any GI symptoms as a result of eating foods that contain gluten, there's no need to cut it out of your diet unnecessarily. I do like to recommend that people try to incorporate at least one fruit and one vegetable with every meal. I really take a very individualized approach when I'm coaching my patients because everybody starts at a different baseline level. So I like to approach my patients where they are, and that's different for everyone.
For almost 30 years, St. Luke's Department of Community Health has grown to become a leader in promoting health for the most vulnerable communities across the region. As a nonprofit organization, St. Luke's conducts community health needs assessments every 3 years. This year, we had a record 15,148 surveys completed and 9 community forums conducted.
Thank you for participating.
Thank you.
Thank you for participating.
Learn what makes you unique with no-cost genetic screening through DNA Answers, a community health research program available through St. Luke's. Learn how your DNA impacts your health and if you are at risk for certain cancers and hereditary high cholesterol, a cause of heart disease. Gaining a better understanding of your genetic health risks can help you and your doctor personalize your care for a healthier future. Health insurance is not required to participate. Learn more at DNAanswers.org.
Welcome back to St. Luke's Health Now. Tonight we're discussing how to reset our gut from experts at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting questions that we'll get to later in the show. Joining me are Dr. Kathy Yoon and Dr. Mursal Sekandari. Let's dive deeper into the importance of gut health and the ways that we can prevent illness. Dr. Yoon, I'm going to start with you, gastroenterologist. This is a complex organ of the body. We say GI. I don't know that any of us really know what that means. So can you explain it to us and break it down a little bit better?
The digestive system is important in moving food down the GI tract. So what it does is you first eat the food, it breaks into smaller pieces, it gets absorbed inside, and when it reaches the large bowel, which is large intestine, water gets absorbed and the waste becomes stool. So in this process, nerves and hormones help with digestive process as well.
You mentioned hormones. What role do they play in your gut health, and how do you analyze that and incorporate that into your diagnosis?
So the gut system is innervated with a lot of neurons. That's like the second organ in our body with a lot of nerves. So they get signals from the brain and then they signal the gut system to start the digestion process. So we don't actually know exactly how we can manipulate that to make the gut healthier per se, but we know that there's a lot of interaction between the gut and brain. So that's why disorders of brain gut is very important nowadays.
Interesting, very interesting connection. And Dr. Secondary, I want to ask you about the connection between what we consume and our diet and our lifestyle choices and sort of our digestive system and our gut health. What are you seeing with patients and what advice do you have for them?
Your day-to-day lifestyle choices is going to make a big impact on your gut health. What we're eating, how often we're eating, whether we're hydrating, whether we're eating fibrous foods, whether we're exercising, how we're responding to stress and anxiety, whether we are taking antibiotics often or taking pain medications like ibuprofen, Aleve, Advil regularly. All these make an impact in our gut health, and working on improving our day-to-day really makes a difference. So eating nutritiously, meaning not processed food, eating more fiber, exercising, drinking plenty of water, fluids, so around like 64 ounces, getting good sleep, that definitely makes an impact on our gut health. So really focusing on what we do day to day makes the biggest difference, instead of like trying to find something miracle, like a miracle medication out in the market to make an impact. I really believe that, as I tell my patients all the time, if you build good habits, that's really going to be a game changer.
Well, that's true for all of life as well, so really good advice. Dr. Yoon, these are a lot of buzzwords right now. We hear a lot about gut health, we hear a lot about microbiomes. What are microbiomes? Is this a real thing, and is it important to gut health, and how do we influence it?
Yeah, of course. So gut microbiome is the collective microorganisms in your gut. There are about like 100 trillion microorganisms, mostly bacteria in our gut system. And there are a lot of like research going on in microbiomes. One of the things that is evidence-based in our specialty is more for like C. difficile infection. We use like FMT, which is a fecal microbiota transplantation, to help with recurrent C. diff. So that would be like one of the evidence-based medicine that we do with like microbiome, altering microbiome. But I know it's like a field that it's getting more spotlight nowadays.
Dr. Secondary, we also hear a lot about prebiotics and probiotics, and it's hard to know what you're supposed to be taking, what is a good source, and what's the proper amount. Can you tell us a little bit more about pre and probiotics?
So the definition of probiotic and prebiotic. So probiotic would be live microorganisms that have health benefits. Prebiotic, essentially, this is the food for the live microorganisms. So examples of probiotic would be fermented foods, kimchi, sauerkraut, yogurt, and then examples of prebiotic would be like garlic and onion. You can also have probiotics as a supplement as well. And in terms of what kind of probiotic brands would I recommend? So this one is a little hard to address because there are a variety, and you definitely want to do your research on which product you end up buying, because the things that you want to kind of focus on is in a capsule where they last until they're in the large intestine, because the digestive tract itself will break that off and a lot of it actually dies out, so it doesn't really provide that assistance. So it's definitely important to find one that's proven to work and last.
Excellent. Dr. Yoon, what about the most common gut disorders? What do you see most often with digestive systems?
I see a lot of people coming with like constipation, diarrhea, and we also see a lot of like inflammatory bowel disease, and we see people for colon cancer screening.
And Dr. Secondary, you're often the first line of defense and where they start. When do you make a referral to someone like Dr. Yoon or another gastroenterologist?
So if they have consistently and the duration of how long they have like the bloating, abdominal cramping, their diarrhea, if there's any red in the diarrhea, so any blood, and how, the chronicity, I would say that's when, if like I've tried things that doesn't help the patient, then I would say it would be a good idea to get evaluated by a specialist.
And Dr. Yoon, when someone is referred to you or anyone in the gastroenterology field at St. Luke's, what are some of the things you run them through test-wise to figure out what's going on? Again, very complex system.
One of the things I want to figure out is like, what other symptoms are you having? Like such as, is it diarrhea, constipation, or do you have some kind of obstructive symptoms?
So that individual testing, I would imagine, is really important to figure out what's going on.
Exactly.
Dr. Secondary, people often live with sort of chronic inflammation and bloating and don't even realize they're living with it. How do you figure out that there might be something more going on and look at a gut issue that could be related to a bigger health issue?
So it's about, asking certain types of questions. As you uncover and ask more questions, you can see that they have cramping or coughing, which could be from acid reflux, or they have this chronic fatigue that they are relating to stress. Like breaking it down and then looking at like blood tests and further evaluating it to kind of figure out a problem, because there are a lot of signs that could be a gut health issue.
So in other words, we don't want to ignore the signs and symptoms. I know you guys both mentioned things like sleep and diet and exercise being important. Dr. Yoon, what is the signal that you might have a gut issue? What are some things people might want to say, hey, I might need medical attention for this?
Definitely, if they see blood in the stool, I definitely want to see these patients sooner than later. Other signs would be vomiting and constipation, diarrhea. Those are a couple of signs.
Dr. Secondary, what about someone who doesn't have any of these more extreme symptoms Dr. Yoon mentioned, but they get a lot of acid reflux, they get bloated after every meal? Is that cause for concern? Should they talk to their doctor?
Definitely. That usually is a sign for gut health issues. So some other signs that I would say, like some patients like talk about, is skin rashes. So if they're having worsening of their acne, having flares of eczema, those would be a sign that it could be correlated to their gut health. If they're having a lot of stress and anxiety, that in itself, or poor sleep, these are all signs that can tell me that it could be their gut issues that's making it a problem for them.
Absolutely important not to ignore what's going on with your gut. It's incredible how much information is available and within our reach in our community. Speaking of, we have some questions sent in from the audience. We'll get to those right after a short break. Stay tuned.
Hi, I'm Lori Hagson. I've been a patient with St. Luke's for over 9 years. I've been a patient of Dr. Secondary's for several years, since she started with St. Luke's. What prompted me to start this weight loss journey was my cholesterol was high. I was in stage 2 kidney disease. I was pre-diabetic and morbidly obese, and I knew I had to get my weight under control. What motivated me was my older daughter and my granddaughter, because I wanted to be around longer for them. The conversation with Dr. Secondary when I started this new journey, it was trying to eliminate the prediabetes, to get my weight under control so I wouldn't become insulin dependent. The advice Dr. Secondary gave me was, I do intermittent fasting, nothing to eat after 7 p.m., nothing to eat before 9 a.m. Cut out all processed sugars, limited to no snacking at all. 2 meals a day in the morning and at night, pasta once a week. I eliminated all breads, limited carbohydrates, and drinking a lot of water. This new diet and lifestyle is completely different than how I was living before. Before, I didn't think twice of grabbing a bag of pretzel nuggets at night when I was watching TV, snacking and picking as I was cooking. It's a total lifestyle change for me. Everything has improved. My good and my bad cholesterol ranges are definitely better than before I started. And I find myself more active. I want to get out and walk more. I'll go out and work in the yard more. When I was heavier, I wouldn't have done that. Dr. Secondary as well, she's been a huge support. She encourages me when I'm hard on myself. Not only Dr. Secondary, but everyone that works for St. Luke's, they're phenomenal. They're friendly, they're supportive, they give you encouragement when you need it. I couldn't ask for a better support system. Good gut health does lead to having a better life overall. I want to keep up this lifestyle for as long as I can. I would recommend St. Luke's because you have extremely caring doctors, staff. They care not only about you physically but mentally, and they're there to support you when needed.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
Kids have enough to worry about, like tea parties, problem solving, and, well, growing up. So let us worry about their health. St. Luke's Pediatrics.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. We've had an engaging conversation about gut health thanks to our amazing panelists from St. Luke's University Health Network. Now it's time to answer some questions from the members of our community. Okay, Dr. Secondary, I think this is for you. I am 45 and I live with constipation. I don't want to rely on laxatives or prescription medication if I can help it. Is there any way I can help myself naturally? This is a great question because a lot of people would love to avoid medication. What can they do?
So increase your water hydration. So making sure you're drinking plenty of water fluids, like 64 ounces would be a good average. Increasing your fiber intake, so that way it bulks up the stool and and therefore you can have better bowel movements. Exercising, because when you exercise, it stimulates the bowel, so it helps with movement. You can take natural laxatives like prunes, figs, flaxseed, so that can also stimulate, and trying to stay away from processed foods because that does the opposite. So those are some ways that you can definitely help.
Well, the tried and true answer, right? Drink water, get sleep, get exercise. Works
it's
for
easy.
Your health. Exactly. All right, Dr. Yoon, this question is for you. I tend to experience gas and bloating, especially after eating a big meal. My wife tells me I might have a leaky gut. What is this, and do you have any advice? We hear that a lot too, leaky gut.
Yes, I did hear about leaky gut, that phrase as well. That's not a phrase that we use in the medical field per se. So I want to focus more on the symptoms, if he's having bloating and flatulence. The other thing that I want to see is how's his bowel movement, because that's very important to figure out what's going on. So for instance, if he is saying he's having diarrhea on top of all this, there are a lot of different possibilities. So the testing would be some blood tests, stool tests, even a upper endoscopy, but it depends on what his symptoms are and then what the blood work shows.
So very personalized and important to just get in to see a doctor and then have those questions asked. All right, Dr. Secondary, this is for you. I have so many questions about fiber. What is the difference between soluble and insoluble fiber? How much should we eat daily, and what are the best sources? Another question I think a lot of people have.
So there are two types of fiber. So the soluble is one that dissolves in water, and this helps to regulate your blood sugars and even your cholesterol levels, whereas insoluble, it does not dissolve in water, and this makes it through the digestive tract and gets to the large intestines, and this bulks up our stool and helps with the bowel movements. In terms of how much we should be having on average, it should be about 30 grams per day, and actually most Americans eat about 16, so we're not eating enough fiber for sure. And in terms of the best way to get it is definitely through food. So your diet is your main way, and that would be eating whole grains, legumes, vegetables. Those are gonna definitely help to increase your good
And
fibers.
if you aren't getting it through your diet, is it smart to add something into your morning water or morning coffee?
So yes, Vitavisol, which is fiber, you can get it over the counter and you can incorporate that into your diet for sure.
Okay, so those supplements are something that will help. All right, Dr. Yoon, this question is for you. I was just diagnosed with irritable bowel syndrome. Can you explain what causes this, and can resetting my gut help with symptoms? So there's a couple triggers in there. First, what's irritable bowel syndrome, and what does it mean to reset your gut?
So irritable bowel syndrome is when you have abdominal pain or discomfort at least once a week for the past 3 months, and then the symptoms should have started at least 6 months beforehand. And a couple criteria that they have to meet is pain or discomfort with defecation, and change in stool frequency, and change in stool consistency as well.
Okay, and what about that idea of resetting your gut? Is that something that's possible?
I think that's like a buzz phrase people use, but I'm not sure how we can like reset the gut, but I think we can have like a healthier diet, or some diet to help with the bloating sensation per se. And then the bloating sensation will be helped with low FODMAP diet.
And can you explain to us what is a FODMAP diet?
Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Those are carbohydrates that's harder for bacteria to break down, and that causes a lot of like bloating sensations. So low FODMAP is avoiding that kind of carbohydrates.
Okay, so there's a lot they can do, but it is important to understand what's going on first and maybe cut some things out to see what might be affecting you. All right, Dr. Secondary, this question is for you. When I lay down at night, I get a small, persistent cough pretty much most nights of the week. Could this be related to my gut health?
Yes, that sounds like it's acid reflux. So trying to evaluate what your triggering factor is going to be important. So if you're eating close to bedtime, if you are eating spicy foods or tomato pastes kind of types of foods, that might be the causing factor. So eliminating that or decreasing that, avoiding eating close to bedtime. If you see an improvement in that, most likely that will improve those symptoms.
Dr. Secondary, is there a connection between our gut health and our immune system?
Yes, there is. So in the gut system, there is immune cells that's involved with kind of monitoring the gut health. And we also have the trillions of microbiomes in our gut that try to stabilize and train the immune system to respond to good versus bad pathogens in the gut. And then we also have the gut lining, which is a barrier. By trying to stabilize that and make that strong, we can prevent from the immune system reacting and therefore leading to issues like autoimmune diseases, allergies, and metabolic syndrome, because there is a correlation with what we eat, how our gut health is, and increasing or causing or worsening chronic conditions.
All right, great. Well, before I let you both go, I'd just like to ask you one final question, which is, what are your messages to patients out there who might be sort of suffering in silence? Dr. Yoon?
I want the patients to know there are people out there like us who's ready to listen and talk about like uncomfortable subjects. I think people are embarrassed to talk about their bowel movements. We're out there, so like just come and see us and we'll help you.
Excellent. Dr. Secondary?
Definitely don't be afraid to ask the embarrassing questions, because that's our job, and we've heard a lot of crazy things or embarrassing things. You don't have to worry about feeling embarrassed, because we're here to help.
Excellent. Thank you both so much for great information and for being here to uncover more about our gut health. For more information on gut health and the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. Thanks for tuning into this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.